on TV, you know, homosexual couples, and the media has done things to help us to understand that. Can the media do things to help us to embrace mental illness as well, with the TV shows and the things that are meant to watch and involved in? Thank you. Next table.
One thing that we had thought would be very helpful is for more education in these local school districts on trauma-informed care. And with that, building on more relationships within the schools, because often these are the only places that kids are safe for 8 hours of their day. And then another thought that came out was for people to have put more effort into knowing what kids are going through in their home life, and it may or may not be something physical or, you know, abusive in any way, but it could just be that it's not a good match for their personality, and then that has an effect on their own mental health.
Thank you.
Yeah.
Table 12.
We'd like to focus in on the media, and part of the suggestion was to actually form a task force that would analyze the media here in the last year or two, in radio, television, and a newspaper, and actually document how they actually either handle the issue, avoid the issue, what they've written about it, and go sit down with the editorial boards or the program directors and say, you know, at your station or over the airwaves or for this newspaper, this is how you have been presenting this issue to the community, presuming that I'm sure most of them don't really have a good grasp of that. So that very specific project.
Thank you.
We had thought about educating church leaders and the church community so that when people came for spiritual guidance in mental health issues or other issues, that the church leaders would have some idea and education behind mental health issues so they could help intervene when necessary and refer when it was something they were unable to handle or help the person further.
Thank you.
Well, we talked about like making these meetings more open to the public. Like what we had today, that was good. To have more meetings like this. And in terms of the insurance parity, we need to have equal health coverage for mental illness as well as physical illness.
At this table, we talked about everyone in this room being able to contact their representatives, whether it's legislators or congresspeople, and talk about how important it is to have mental health parity for youth and adults. And the other thing is that there's a NAMI, and we think that that's more adult-oriented, that we should have a NAMI Junior.
Well, in the vein of letting young people know what resources exist and how to access them, and also having an increase in awareness and tolerance among young people, we thought about taking advantage of some of the professionals how we already have contact with the schools, whether it's the school liaison officer, when the Boys and Girls Club comes in combination with YMCA, and whole conversations, kind of like we're having here with the students to raise that awareness. And it was brought up, you have some of those conversations around sex ed, well, why not have some of those around mental health and raise awareness around that, but also to focus on not just the youth may be struggling with these issues, but remember as well the family support system and increasing awareness and bringing families together so they're responding appropriately and providing that support there. And whether it's a neighborhood center or it's a space that exists in churches in the community, is to sharing the resources there.
Great, thank you. Next.
Yes, we had a really good discussion. We've got a lot of Bill's captive audience over here, and these guys are great. So, extra credit points for all of them. So, we had a really good, lively discussion, really centered around the idea of trying to connect with parents and families where they're at. So trying to fill those gaps in support, training, education. Most of these kids, that's their front line. So the more we can focus on strengthening those families and those connections, the more preventive we're going to be, the more effective we're going to be down the road. And the other thing was to advocate loudly for treatment dollars versus correction dollars.
A couple of things that we came up with was more honest and open communication and sharing, kind of like Deb and Randy did. It puts you on a very personal level and helps you to relate so much better. And another one that came up was possibly changing laws so that when you have a youth that has a problem, oftentimes law enforcement's hands are tied and there's nothing they can do to be able to maybe refer them to the help that they should be able to get or could get, but they're not able to do that. So maybe help them to enforce law changes that can provide for that.
That's a good one.
Right, we discussed education also, but more in a sense, not just educating educators, but educating the youth about mental illness as a way to increase tolerance. We talked about expanding curriculum and health classes, just as much education as possible to increase knowledge, and which will hopefully increase tolerance.
Well, I think that in our discussion, I liked what the great Professor McCormick had mentioned about empathy training. But our table kind of talked about the best way we thought maybe to do that was to have kids educate other kids. Like having high schoolers go into middle schools to talk about the mental illness or the mental health. And because who knows what better mental health issues are going on than the kids in the schools, because in the schools, communities, the kids have changed even since we were there a few years ago.
Are there any tables we've not heard from? Any tables that have some $1 million suggestions that we need to make sure to get onto these lists? All of these will be collected and it will all be in the report, but is there anything